A very good evening, everyone. So welcome to our weekend live session. First of all, please confirm the audio and video streaming. If you have any issues, do let me know in the comment section. So once again, a very good evening. Let's go ahead with our case-based discussion this weekend, as we have mentioned in our schedule. So it's been quite a while since we had a live session. I hope you guys are all doing good. And as I keep on reminding, if you have any queries or you need any assistance, always feel free to get back through mail at cowtobedentist@gmail.com 24/7. We are there with you. And as I said in today's update, we'll have two live sessions. One, a case-based discussion, which we'll be conducting now, and a second session tomorrow, that is on Sunday at 11 a.m., where we'll have a general interaction and Q&A session. You can pose your questions related to preparation as the exam NEET MDS 2022 is approaching. And also those who are planning for 1 year preparation NEET MDS 2023. So we'll have a live, lovely interaction tomorrow morning at 11 a.m. That is Sunday. I'm sure you'll be waking up by that time. So I hope the streaming is going on good. Yeah, I really appreciate your feedback. Thank you. So let's go ahead without any further delay. Right. So before we start, so as you know, the concept, like we'll put a context or a case, and then we'll discuss some related questions, including image-based questions, right? So we have actually conducted tens of sessions prior, and since the exam date has been announced, we're coming up with these live sessions again, and we'll try to increase the frequency as the exam is approaching in the coming days, in the coming weeks. And before we start, we have the following courses, which we launched in the month of March, that is this month, towards NEET MDS 2022 and 2023. So as you can see, crash course, special batch, and mission 12 batch. You can find all the details on our website, ptbdacademy.com. And before we start, let's begin with this inspiring quote. Success is 99% enthusiasm and 1% effort. See, first of all, the point here I'm trying to make here is that not that you shouldn't work towards achieving your goals or dreams in order to appreciate success, but rather, if you observe the quote, it's about 99% enthusiasm. See, by definition, enthusiasm is intense and eager enjoyment, interest, or approval. So it's all about that kind of positive environment or atmosphere which you create in your mind, which plays a very key role in experiencing and appreciating success. And once you have that positive mindset, once you have that kind of energy, positive energy to learn, and if you're looking forward, right? So if you have this quality of enthusiasm, success happens as a natural consequence. And if you go even a bit deeper, success is not something which is seen as just as an end product or as a consequence of our action. But as I said, if you go a bit deeper, you'll start experiencing it each and every moment, right? So success is 99% enthusiasm and 1% effort. So it's all in your mind. And once you decide to tap into your potential, once you decide to really explore in line with your passion, then obviously you will not just achieve success at the end, rather you will start experiencing success each and every moment of your life. It can be personal or it can be professional. In fact, there is no such distinction. One influences the other in multitude ways. So success is 99% enthusiasm and 1% effort, right? So I hope you got my point. And now let's start with a context-based or case-based question. So here is the context. A 4-year-old boy showed signs of learning disability and aggressive behavior besides pain in joints. It was observed that he had an irresistible urge to bite his fingers and legs. The laboratory investigations revealed megaloblastic anemia and elevated uric acid levels. So the ones which are being highlighted in red are the keywords which are actually like hints for you to answer this question. You can look into the age of the patient and various clinical signs. And also characteristically, you can see that the third point, the third sentence, it is observed that he had irresistible urge to bite his fingers and lips. Lab investigations show hyperuricemia. So keep this context in mind and let's see if you can answer questions related to that. And before we go ahead, as I keep on reminding, case-based questions, the only challenge is the amount of time that you need to allot to go through that question. That's the only challenge you have. However, compared to normal questions, these questions are relatively easy to answer because we have so many hints which are incorporated in the question, which should enable you to answer them with greater ease. The reason why I'm trying to make this point is most of you are worried about context-based or case-based questions. You think they are very challenging, but as a matter of fact, they're relatively easy to answer given the hints you're being provided with in that particular context or case. So keep this context in mind and let's see how many of you are going to answer this question. So some of you have already answered before me posting this query. Yeah, so what is the most probable diagnosis? Rett syndrome, Tourette syndrome, Corellia de Lange syndrome, Lesch-Nyhan syndrome. So A, B, C, and okay, option D or option E. So which one do you think is more appropriate answer? So try answering this question. In the meantime, let's review some information related to these options for your benefit. So first and foremost, let's start with Rett syndrome. So for your information, in all these syndromes, there is this self-mutilation feature, right? So that's one of the common points or symptoms associated with these syndromes. So Rett syndrome is a brain disorder that occurs almost exclusively in girls. And the most common form of this condition is known as classic Rett syndrome. Mutations in a gene called MECP2 underlie almost all cases of classic Rett syndrome and some variant forms of the condition. This gene is known to provide instructions for making a protein called MECP2 that is critical for normal brain function. And they have given so many signs and symptoms which include breathing abnormalities, splitting, drooling of saliva, spitting, unusual eye movements such as intense staring, excessive blinking, cold hands and feet. We'll provide all this information in the form of reference materials in ED classes so you can go through the same. So Rett syndrome in brief. And then we have this Tourette syndrome. You might have heard of it. We also call it by the name tics, T-I-C-S. So Tourette syndrome is a condition of nervous system, usually called as tics. Tics are nothing but sudden twitches, movements, or sounds that people do repeatedly. People who have tics cannot stop their body from doing certain things. Like, for example, a person might keep blinking over and over, or might make a grunting sound unwillingly. Having tics is a little bit like having hiccups. Even though you might not want a hiccup, your body does it anyway. As mentioned in CDC website, we'll share additional information, including the causes, management part, as I said, in the form of reference material. And then we have this Corellia de Lange syndrome. In the meantime, you can try answering the question. I'm sure majority of you will get it right. So Corellia de Lange syndrome is a developmental disorder which affects many parts of the body. The features of this disorder vary widely among affected individuals and range from relatively mild to severe. It is characterized by slow growth before and after, leading to a short stature, intellectual disability that is usually moderate to severe, and abnormalities of bones in arms, hands, fingers. And most people with Corellia de Lange syndrome have distinctive facial features, including arched eyebrows that often meet in the middle, low set ears, small and widely spaced teeth, and a small and upturned nose. And many affected individuals also have behavior problems similar to autism, which is a developmental condition, as you know, disorder which affects communication and social interaction. And what about Lesch-Nahan syndrome? Self-mutilating behavior is obviously one of the features, along with hyperuricemia, which is seen in all different forms of Lesch-Nahan syndrome. And as majority of you have rightly chosen, Lesch-Nahan syndrome is right answer. Let me review or give you brief information about the same. So Lesch-Nahan syndrome is an inborn disorder caused by deficiency of HPRT enzyme, which is hypoxanthine guanine phosphoribosyl transferase enzyme, which is an enzyme of purine salvage pathway. The enzyme is responsible for recycling purines by converting guanine and hypoxanthine into guanosine monophosphate and inosine monophosphate, respectively. And lack of the enzyme causes increase in guanine and hypoxanthine, which are ultimately converted to uric acid, leading to hyperuricemia, the situation which you have seen in this particular context. And there are different range of clinical manifestations in Lesch-Nahan syndrome. It's not one particular disease. There are different range of manifestations depending upon the amount of enzyme that is left to function in that particular patient. So the characteristics defining Lesch-Nahan syndrome are hyperuricemia, neurodevelopmental abnormalities with involuntary movements, including self-injurious behavior. In fact, it's very interesting that till date, there is no link up or reason why there are neurological manifestations or the relation between Lesch-Nahan syndrome and why we're seeing these neurological manifestations. Studies have shown that there is a dopamine level abnormality in Lesch-Nahan syndrome patients, but the exact reason why dopamine levels are being affected in a situation where there is a disorder in purine metabolism, the exact link or mechanism is not yet known, right? So the most probable diagnosis, as you all rightly mentioned, is Lesch-Nahan syndrome. So let me get back to the context once again, and I wanted to observe the context, including the keywords, very carefully. So very young, and most importantly, this Lesch-Nahan syndrome is almost exclusively seen in men or male sex, even though there are few case reports, very few case reports where Lesch-Nahan syndrome has also been reported in females. However, majority of the cases, almost all the cases according to literature, it can be Satyanarayana or it can be any PubMed indexed articles, they state that almost all cases are exclusively seen in males. And you can see neurological abnormalities, learning disability, aggressive behavior, besides pain in joints, which is obvious because due to deposition of these uric acid, urate crystals. And it is observed that patient has so irresistible urge to bite fingers and lips, that is self-mutilating behavior, lab investigations revealing anemia and elevated uric acid level. Okay, Monica, Billy has 6. Oh, thank you for the information, Monica, and I sincerely hope that such kind of questions or questions along those lines will not be asked in NEET MDS. But we can't say, just like how you have geography, history, aptitude in NEET MDS nowadays, maybe we can expect these kind of questions as well. We can call them as celebrity round of questions. Okay. And I'm sure you guys are going to do great in this particular round of celebrity round, because I'm sure you all follow celebrities, right? Okay. Now, identify the appliance. And it's quite interesting that this appliance is discussed while dealing with Lesch-Nahan syndrome for a particular reason, which we'll discuss very shortly. So I took this as an opportunity to share this appliance and discuss about the same. So let's see how many of you are going to answer it right. So observe the illustration on the right part of your screen and try identifying the appliance. Is it lip bumper, Herbst appliance, Holly's appliance, none of the above? In fact, we discussed removable orthodontic appliances very recently in one of the live sessions. You are all very enthusiastic in participating in that hour-long session. I think we took more than 1.5 hours. So which of the following options do you think is more appropriate answer? So because of self-mutilating behavior, physical restraints are used, right, in order to prevent or manage this self-mutilating behavior. Physical restraints such as elbow restraint or intraoral appliances such as this or a mouth guard, all of them can be used. These are physical restraints to address this self-mutilating behavior. So as majority of you have rightly chosen, yeah, it's a lip bumper. So let me review some information regarding the same. Lip bumper or lip plumper is a functional component that is used along with lower or upper fixed appliance. It is combined fixed removable appliance or component of a fixed appliance. And as you can see, it actually conforms to the shape of the arch. It's a vestibular arch carrying an acrylic pad engaged to lower molar bands on both sides. The pad stands 2 to 3 mm away from the teeth and gingiva. It lies about 4 mm below the cervical margin of lower incisors. The lower lip is thus held forward. So observe its orientation and also the molar band, right? So the diameter of the wire used actually varies. Several studies quote different values, but according to standard textbook, it's 0.93 mm. The wire can either be soldered or inserted into molar tube with U-bend or coil spring. So first of all, there are many uses of lip bumper. However, in this particular context, it is used to spare the lip from this characteristic and strange self-mutilating behavior. And let me review some information in regard to that. So self-mutilating behavior. In specific, we're talking about physical restraints. As I mentioned at the beginning of this slide, we use physical restraints. So behavioral symptoms are managed with psychiatric, physical, and medical intervention. Most cases need a combination of these interventions. In fact, authors say, like, we need multidisciplinary approach in order to address or treat Lesch-Nyhan syndrome, given the wide range of clinical manifestations which are there. So stress increases self-mutilation, and so stress management has shown to be effective. Aversion techniques tend to increase self-mutilation, and so such techniques need to be sidestepped. Physical restraints like elbow restraints, dental guards, lip bumpers are helpful temporarily. Most patients feel relieved with restraint, while some patients themselves request to be restrained when compulsive thoughts set in. Interventions such as extraction of teeth are the long-term treatment for those in whom the conservative measures cannot effectively protect the patient. Extraction of teeth also has been indicated and has been done in several situations or cases. There are several case reports available as well. So anyways, as you rightly mentioned, it is lip bumper. Option A is right answer. Very good. Yes. Now let's see how many of you are going to get it right. Hallmark of Lesch-Nyhan syndrome include dystonia, dysphagia, cognitive impairment, self-injurious behavior. So which one of the following do you think is a hallmark feature or symptom of Lesch-Nyhan syndrome? So in fact, we have been discussing about this feature right from the beginning. So there are a wide range of clinical manifestations, as I said, depending upon the exam levels, but hyperuricemia is one of the signs which is commonly seen. But coming to various symptoms, so which one do you think could be the hallmark of Lesch-Nyhan syndrome? See, first of all of the options mentioned here are features which are seen in Lesch-Nyhan syndrome. So among them, which one do you think is more appropriate answer? I think you're getting it. Okay, only one option is right, and yeah, as majority of you have chosen, option D is right answer. Let me review some information regarding this. Self-mutilating behavior, and in the meantime, observe these illustrations, clinical images. So self-injurious behavior is the hallmark of Lesch-Nyhan syndrome. Consider this very, very important. Self-mutilation is not seen in variants of Lesch-Nyhan syndrome. The most commonly noted behavior is self-mutilation, from biting of lips, fingers, cheeks, including tongue, causing profound disfigurement. This behavior usually begins with erection of, there are various factors which come into play: the neurological factor, the metabolic factor. In fact, there is no clarity as to why there is a link up between the biochemical deviation and the neurological manifestation. The research is still going on along those lines to find out exactly why this self-mutilating behavior or neurological changes are happening in Lesch-Nyhan syndrome patients. Contrary to the thought that patients continue with self-mutilation due to sensory deficit, all sensations, including pain, are intact. Self-mutilating, we think patients might not be perceiving pain, but that's completely wrong. There is no sensory deficit. Patients can perceive pain, but still resort to this self-mutilating habit. So self-injurious behavior is a result of compulsive behavior, and restraints can control these actions. Behaviors like head banging, it's not just self-mutilation through biting, but self-mutilation through head banging, limb banging, eye poking, which are usual presentations in other disorders, have also been described. Reports have also mentioned compulsive aggressive behavior, where patients try to inflict injury to others by pinching, spitting, grabbing, hitting, and verbal abuse. And once the compulsion passes away, they usually tend to apologize for their behavior. So this is a behavioral pattern of Lesch-Nyhan syndrome patients. Not in all variants, but in situations where the loss of enzyme activity is seen to up to 80% according to various review articles. So as you can clearly see, ulceration, crusting, laceration, scarring on index finger, on lips is quite evident, right, in these clinical images. It's very unfortunate. But, and all, anyways, as studies have mentioned, it is seen in 1 in 3 lakh or 1 in 2 lakh cases. So relatively rare presentation, but if an individual suffers from this genetic related deficiency of enzyme, obviously it is a very unfortunate scenario or situation. Allopurinol is a drug which is being suggested as a main mode of therapy in order to address this hyper uric acid situation in patients. But unfortunately, again, patients usually survive till their age of 30s, and mostly it's kidney failure that has been reported in some articles as a reason for death. Right. So let's conclude with these questions. I hope you had some insights into this Lesch-Nyhan syndrome. And I'm also hoping that you're making notes of various important points which we are discussing in the process of these discussions. And before we conclude, I have the following homework questions for you for this particular session. First and foremost, what is Keele-Fig-Miller syndrome? Is it different from Lesch-Nyhan syndrome? So what exactly is this syndrome, and is it in any way related to Lesch-Nyhan syndrome? So first and foremost, what is Keele-Fig-Miller syndrome? Second question, when does the self-mutilative behavior start? I mean, is there any time frame? Is there any time period? When does it actually start in a patient with confirmed diagnosis of Lesch-Nyhan syndrome? Third question, what is the difference between salvage pathway and de novo pathway in purine synthesis. So salvage means rescue, right? In general terms. So purine or nucleotide synthesis, we have salvage pathway and de novo pathway of purine synthesis. What is the difference between the two? It's interesting, so try finding out. So make a note of these 3 homework questions. Get back through mail with your answers. We'll verify your answers and we'll provide you key or correct you accordingly, right? So this endeavor is to encourage you to actually participate, and it's a sincere hope that you would enjoy the process of learning, as you will be referring standard literature in order to explore answers to these questions. Okay. So I hope it's clear, and this concludes our case-based discussion for today, for this weekend. Right. So I hope it's clear, and you have any queries, you need any further assistance, feel free to get back through mail 24/7. And as you started this session with a quote, success is 99% enthusiasm and 1% effort. So my point is, I'm not trying to underestimate the efforts which you put in towards fulfilling your goals and dreams, but with right mindset, with a positive mindset. And if you're enthusiastic in doing whatever you wish to do in line with your passion, then you'll start experiencing success each and every moment. And that's it. So let's conclude this session, and I'll see you again tomorrow at 11 a.m. in our Q&A session. So tomorrow is Sunday, and I'm sure it's going to be a fun day. And 2 more months, less than 2 more months towards NEET MDS 2022. So I'm quite sure that you have restarted your preparation or revision with renewed enthusiasm. And those who are planning for 1 year preparation, now is the right time for you, because as the exam this year is happening in May, more or less you'll have 10 to 12 months for the next session, that is 2023, right? So for various reasons, because if the exam is happening in May this year, the counseling can be expected in June or July or even August. So I don't think the exam, next year's exam is going to happen just within a span of 4 to 5 months. So they're going to allot more time, and maybe the exam might be conducted, 2023 exam might be conducted, keeping this year's exam in mind. So I'm sure they'll give 10 to 12 months a gap. So anyways, we'll keep a tab on the official website, and if we have any inputs in that regard, we'll get back to you accordingly. So it's all about working hard, working consistently, and most importantly, believing in ourselves. And this self-belief, the third factor which we keep reminding, is even more relevant nowadays, given the kind of challenges you all have been facing, given the repeated postponements of the exam, given the pandemic situation we are in. It cannot be more relevant now than ever, isn't it? So always keep these 3 factors in mind, and ultimately your success should be solely dependent on your performance, and you need not worry about other factors. It doesn't matter how many aspirants are taking up the exam. It shouldn't matter how the question paper is, because it's going to be the same question paper for each and every one. And all that should matter to you is, are you giving your best to the fullest potential? So that's the only question I want you to keep asking. It's okay how the other person studies, how many hours the other person is allotting, but all that matters to you is, are you giving your best? So just keep asking yourself that question, and keep asking yourself that question till the answer is yes. So wish you all the best. Love you all. I'll see you tomorrow. Good night. Take care.